start with the news then that a 4-year-old girl is fighting for her life at Alderhay Children's Hospital in Liverpool after developing Strep A.
And this comes after 6 primary school children have died from the bacterial infection. Health officials are issuing a warning to parents when it comes to spotting the symptoms.
Well, let's get more from NHS GP Dr Veena Babu. Good to see you this morning. What should we be looking out for and how concerned should we be? Because these headlines are going to cause panic amongst a lot of parents.
Absolutely, and our deepest condolences to the families and loved ones. We can't even imagine what they're going through at this point. I think what we've been telling patients, we have been seeing a rise, even in the last week in clinic, actually even as of yesterday. I've been telling parents, think of how your kids look, feel and feed. You know, so if they look a bit dehydrated, if they're feeling much hotter, check their temperature. So if a temperature above 38, and how are they feeding? In the last 12 to 24 hours, have they reduced their oral intake? Just liquids, solids? Are they having wet nappies? If any of this reduces in about 6 to 12 hours, you want to see your GP.
But that's not always easy. I mean, one of our newspaper reviewers was in here just half an hour ago saying she's the mother of a 2-year-old, tries to see the GP with a child who is worried and can't get to see them for another couple of weeks. I heard. I mean, weren't you shocked? I was shocked.
Absolutely. So I think we have to be strategic about this. The cases are rising. These are facts. What was with the invasive groups of strep infections last year, say it was 0.5 per 100,000, but this year we're seeing about 2 to 3 cases per 100,000, and we've seen deaths in children. This is not something we can take lightly at all. So if your practice allows online consultations where you can message in, where you can book face-to-face, sometimes you have on-call duty GPs working, get your child seen in there. If you can't, take them to paediatric A&E, call 111. This is not something you want to sit at home and wait for because the consequences are dire.
But, I mean, part of the issue, we're talking to Hugh Pennington an hour ago, and he said part of the concern with this, and it's not GP's fault, but they don't quite know what to look for because it's, you know, we haven't seen anything this severe for a long time with Strep A.
I think it's the vagueness of it because the weather's changing, it's getting cold. Most of us will get a cough or a cold or a flu. How do you differentiate that from a life-threatening disease? I think we have to be mindful of if your immune system is already compromised, what does that mean? If you're on steroids, you're diabetic, you have heart disease, you're taking cancer treatment, any of those things, you're already immunocompromised. If someone like that gets a cough or a cold or a sore throat, you want to seek medical advice much sooner. You don't want to wait.
I mean, with Strep A, does it affect adults as well, then?
It does, but not as commonly as children. We see it more commonly between 5 to 10-year-olds.
And we're seeing more scarlet fever now as well. What's the difference? How do the two things compare?
So you can have Strep A presents the most commonly in 3 ways. You can get a sore throat, you can get scarlet fever, or you could get a condition called impetigo. So scarlet fever presents as muscle aches, fever. You may get a rash on the skin, which feels what we call your typical sandpaper rash. So you might get some bumps coming up on the skin, and that could be on the arms, on the chest, or on the tummy. I would advise parents, what we were saying, look, feel, and how your kids are feeding. This is a time to use Google Images to go and type in scarlet fever and how this looks in different children of different skin colour, because how it presents on white skin is very different to how it presents on dark skin. On a lot of the Caucasian children, we may see redness around the cheeks. We may see the tongue getting a lot more swollen, what we call your typical strawberry tongue. You might get a white mucus filling in the middle, and then the tongue gets quite swollen and bumpy. But in darker skin children, we don't see the redness. You may just see the texture change, and you may see the tongue symptoms and the swollen tonsils. So this is a time to use the internet, get that knowledge base up, and understand these are your worries. And when you speak to a physician or anyone from a medical profession, say, I'm worried about, strep. And
wouldn't you advise as well, I know I may be asking the wrong person, but actually to be quite firm with your GP or your surgery. Say, I am a parent, this is my child, and I am worried and I'm going to make a fuss until you see them.
You're asking the right person, I assure you, because I encourage parents to make a fuss. Because if a parent is worried, a kid can't speak for themselves. It's a parent's responsibility. So if a parent is worried, we cannot ignore that. You have to, if your practice does not have the capability or the resources to see the patient that day, we redirect to 111 or to the local paediatric A&E, and they will definitely get seen.